Earlier in the week, we were talking to Dr. Larissa, and she volunteered to be seconded to a frontline ICU unit in another hospital in London. We're joining her there again. Larissa, last time we saw you, you were quite exhausted. You'd had some long days. Have you managed to have some time off? And how important is that time off?
It's really important, and it's something we're all making an effort to do. So each morning when we come in, we sort of see how one another is doing and whether anyone needs a little bit of time off to rest. If anyone's feeling exhausted and we've got enough staff cover, we just allow that time for people to go home and recuperate. And also it's quite important in terms of just reducing our viral exposure and load in order to just try and make sure we stay as fit and healthy as possible. But I'm pleased to say that since I last spoke to you, there's been a real turnaround in terms of some cases that we're seeing. I'm wearing my special hat today, which is always a good sign because it means things have been amazing in a sense. We've really seen several patients turn a massive corner. And if you remember last time I spoke to you about a patient whose hand I kept squeezing when he was unconscious and on a ventilator. So he was my very first patient that I met in the intensive care unit when I first started. And just to give you a little bit of context as to how he came in, when he arrived about 3 weeks ago to the hospital, he really was at death's door. He couldn't breathe. He was incredibly unwell, and he's in his 70s. He's got another lung condition, ex-smoker, so many factors against him, and really his chances of survival were minuscule. One of my brilliant colleagues here managed to intubate him, and he had the best possible care and support. So I grew very attached to him, and I visited him each day, even when I moved to a different part of the intensive care unit. And then just 2 days ago, in fact, after I finished chatting with you, we had a call to our ward to say that he was being admitted. And he came up, he was alert, he was chatting in bed. I wasn't sure whether he'd recognize me, but he did. And he had this huge grin on his face. And I just went up to him and we hugged and we hugged. Obviously, my protective gear, I hasten to add. And it was just a really, really special moment. I can't even put it into words
and you
to know that he's now going to make it.
Just briefly, you must be learning more about this actual virus and how it works and who it strikes and the effects that it has.
Yeah, it's really interesting, actually, Eamon, because what we're seeing is that the predominant number of people that it affects, we've seen, is the older age group, so over 65, and those with other conditions, whether they be lung conditions, heart conditions, kidney conditions, and so on. They seem to fare much worse. However, it's not to say that young patients are not affected. And in fact, one of our youngest patients is only 28 years old. So it definitely, it is a broad cross-section of people that it's affecting. But really interestingly, in terms of what we're seeing in the intensive care unit, if you're poorly enough to end up here, you have really less than a 50% chance of survival. And the things that people seem to be dying from, aside from problems with breathing and